So I'm an NIHR and UCL professor of global child health, and I work in health system strengthening and equity, and I lead the project called the Neotree. And the premise of what we do is that every day over 6,000 babies die somewhere across the world from preventable causes. So not through expensive drugs or equipment, but just through doing the basics right every time for every baby. So we, over the last 10 years, working in Malawi and Zimbabwe and across a multidisciplinary team, including software developers, researchers and clinicians, have developed the Neotree, which is a digital learning health system for newborn care. What happens is when the baby's admitted, they use the open source Android-based application on a tablet to admit the baby, and then using that data, we then produce a clinical diagnosis and a set of management tasks. So a guide into how to care for that baby. Again, it's really simple things like keeping a baby warm, recognizing that baby needs antibiotics, so not ventilating or the sort of more high-tech interventions. So far, we've cared for over 40,000 babies, or supported the care for over 40,000 babies. We're present in 9 sites, so 8 hospitals and 2 primary health clinics across Malawi and Zimbabwe. We've used the Neotree to train over 1,400 healthcare providers. They tend to be nurses and junior doctors. And over the next year, we're going to be doubling the number of sites that we are implemented in. So we have run implementation evaluation of the Neotree program and have found that it's highly acceptable, feasible and usable, and with both perceived and observed impacts on newborn care. And one of our preliminary findings is that we have halved the deaths in babies weighing 1.5 and 2.5 kilos, which is extremely promising, but an impact that we want to try and replicate and test at scale, which we will be doing in the 7 new hospital sites that we'll be going into over the next year and a half. And then finally, we've also been running health economic analysis. So can we estimate the cost effectiveness of what we're trying to do? And based off that preliminary finding of impact on those small babies, we've found that the cost per healthy life year saved is just over $6, so around £5 per baby. So it's really promising impact that we want to assess at scale. And I guess the main thing that we're trying to get across is that digital data, community engagement and team science can really make an impact on trying to save the lives of those babies that die needlessly every day.